Hey everyone, my name is Lowell Sala. I'm a physician by training and currently work in healthcare and data informatics. I'm currently taking my MS in health informatics at Cornell University or the Weill Cornell Graduate School of Medical Sciences and also working as a technology training coordinator at the New York Public Library. So the problem I'm focused comes directly from my clinical experience because in mental health care, some of the most important signals about the patient's condition, so things about worsening of mood, social stress, or early signs of crisis are often buried in narrative notes. Clinicians write detailed observations, but those insights are difficult to track over time, especially in high volume settings. So, this is why I'm building a tool called PsychE. PsychE is an AI powered system that analyzes psychiatric and clinical notes and transforms them into structured longitudinal insights. So, instead of clinicians having to manually review multiple notes, the system identifies patterns like increasing risk signals, changes in mood, or social instability and surfaces them in a simple, actionable way. I'm initially focusing on community mental health clinics where providers often manage large caseloads and have a limited time per patient. So the problem actually disproportionately affects low-income communities as in many urban clinics serving Medicaid populations, clinicians may see around 20 to 30 or more patients a day. There's a limited time to review the history in depth and fewer resources for follow-up care. As a result, patients who are already vulnerable are more likely to fall through the cracks. So, by helping clinicians detect risk earlier, Psyche can support more timely interventions and reduce crisis events and improve continuity of care. Again, putting the human in the loop. So, long term, this kind of system could scale across healthcare settings, helping standardize how we use unstructured clinical data and to improve outcomes and reduce disparities. So I believe I am well positioned to build this because I've worked on both sides of the problem. As a physician, I've experienced firsthand how clinical decisions are made under time and information constraints. And now with my MS in health informatics, I'm focused on building systems that turn complex data into actionable insights. The goal here is to bridge clinical reality with data systems and to create tools that are actually usable and impactful in practice. Ultimately, I want to help improve mental health from a reactive to a proactive stance, starting with better use of the data that we already have. Thank you so much.